Welcome, Paul. I'm glad you and your family could come in today. I understand that you would like to learn more about schizophrenia? Yes, me and my family are interested in the causes, symptoms, and physiology of schizophrenia. Unfortunately, Paul, there is no specific cause of schizophrenia. There are multiple factors that can contribute, and none have been exclusively proven to cause schizophrenia. Let me tell you about the symptoms and physiology. Schizophrenia is a chronic, debilitating psychotic disorder that involves a disconnection between thought and language. It affects a person's thoughts, feelings, perceptions, and overall behaviors while interfering with the filtering of stimuli from the environment. Schizophrenia affects 1% of Canadians and seems to affect men and women equally. The peak age of onset is 17 to 25 years of age. Positive symptoms include abnormal behavior, incomprehensible speech. They include delusions, hallucinations, grossly disorganized or catatonic behavior, and altered patterns of speech. Negative symptoms include the absence of normal social and interpersonal behaviors, such as the tendency to speak very little, a lack of a motivation, apathy, lack of emotional expression, and an inability to experience pleasure. People with schizophrenia often lose the ability to sort and interpret incoming stimuli, which impairs their ability to respond appropriately to the environment. If you have a first-degree relative with schizophrenia, you will have a 10-fold greater chance of developing schizophrenia than someone who does not. 108 specific locations in the human genome are associated with the risk for schizophrenia. The genes involved are those in the brain tissue and the immune system. Research has shown that schizophrenia is caused by the combined effect of many genes.
Brain abnormalities found in schizophrenic people can occur in the second trimester of fetal development when brain cells are forming. These abnormalities include improper neural connections, enlargement of the third and lateral ventricles, reduction in frontal lobe, reduction in whole brain volumes, and diminished neuronal content in hypothalamus and hippocampus. The neurotransmitters that have an effect on schizophrenia are serotonin, GABA, glutamate, and dopamine. But let's focus on dopamine. Neurons communicate with other neurons through neurotransmitters. Dopamine is a feel-good neurotransmitter that is secreted from the central nervous system and in the peripheral nervous system. In a normal brain, there is a negative feedback loop for dopamine that controls the production, but in a person who has schizophrenia, there is an overactive dopamine signaling that occurs and causes an increased release of dopamine. This can explain the positive symptoms, but not why the negative symptoms happen. Considering dopamine as a receptor, it can be divided into D1, D2, D3, D4 receptors. A person that has schizophrenia will have a decreased amount of D1 receptors in the prefrontal cortex, but in contrast, D2 receptors are increased in the basal ganglia. The effects of having more dopamine receptors is that there is the ability to utilize more of it, which causes the positive symptoms compared to when there is a lower density of receptors, which may be causing the negative symptoms. Normal nerve cells have a plasma membrane made of a fluid phospholipid bilayer. Polyunsaturated fatty acids in the cell membrane have gaps in their chains that allow the membrane to be packed less tightly. The fluidity is necessary for protein receptors to be able to recognize and process neurotransmitters. People with schizophrenia have significant reductions in the amount of polyunsaturated fats that they have in their cell membranes, causing them to have reduced fluidity in the cell membrane. This is thought to inhibit their cell-to-cell communication and contribute to positive, negative, and cognitive symptoms. Neurons have a myelin sheath covering on their axon, which is a fatty extension of the plasma membrane. The myelin sheath insulates the axon and increases the velocity of nerve impulses. In people with schizophrenia, there is a significant decrease in the polyunsaturated fatty acid called nervonic acid in the myelin sheath. By having a decrease in the amount of myelin, neurons are not able to send messages as efficiently. It is speculated that psychosis is caused by poor myelination. Some antipsychotic drugs work on dopamine by blocking dopamine receptors. This helps alleviate positive symptoms only. Omega-3 fatty acid supplements can prevent psychosis by increasing the nervonic acid levels needed for proper myelination sheath formation. Thank you for teaching us about schizophrenia. My family and I have a better understanding of why I have certain symptoms. You're welcome, Paul. Thank you for coming in today.